Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information contacts, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Great. Thank you and good afternoon, everybody, and thank you again for joining us. Just a couple of words here before we get to the numbers. So as I mentioned to you a couple of days ago, our modeling predicted that later this week we will most likely approach the peak of our infections for the St. Louis region. Now, as you know, I've also stated multiple times in the past that models can change and that none are perfect. But the latest information that we have is that the initial crest should be hitting us soon. So I wanted to talk for a second about what that would mean, but first let's take a step back. Weeks ago, elected officials, businesses, and people of the region began a very difficult process of staying at home. Based on what we have seen so far, and this is what we have seen with our data as well, we believe that this approach has worked very well to slow and prevent the spread of this very dangerous virus. However, as we approach the predicted crest in the region, let's talk about what this doesn't mean. It doesn't mean that we're done with this pandemic. And unfortunately, it doesn't mean that the virus has left our community, nor does it mean that the people in the community are any more safe from the virus. The anticipated crest is our best estimate of when a number of infections among our people in the region will be at its highest point. And I think most people would agree that that's hardly a time to relax or let our guard down. Actually, the initial crest creates probably the greatest risk for our people in the region, and that risk will be there a little bit longer after the crest has passed. And that's why we have to continue with our proven measures that have been working so far. We remain on the rising side of the curve in this region, and we have to remain vigilant. Loosening restrictions now could result in a spike in cases and further delays as we work towards reopening the economy. The steps we have in place are working, and they should remain in place until we know that we are beyond the peak and until we have all of those strategies in place that I've mentioned before, such as robust testing and contact tracing capabilities, and that those are all in place and functional. Now let's talk a little bit about where we stand today. So as of today, we have 685 hospitalizations. And again, remember, these are COVID positive plus patients under investigation. And this is down yesterday from when we had 750. We're still way up there and from where we started in early April. There are 185 intensive care patients, which is about the same as yesterday when we had 187. And we have 133 patients on ventilators, which is about the same as yesterday when we had 130. And again, the good news, another 47 COVID patients were discharged today. As of today, our hospitalizations are still up nearly 50% from where we were in early April. More people in the region are being infected and hospitalized, and the virus continues to spread. So this is not the time to remove those proven steps that we have worked so hard to keep people of this region alive. Stay at home, wash your hands, continue to clean the surfaces, and practice social distancing while we work to stop the spread. And now I'd be happy to take any questions from the media.
One media outlet writes that a viewer was quarantined after testing positive for COVID-19. The viewer says he started feeling better a few days before the quarantine was scheduled to end. When is someone allowed to break a 14-day quarantine, or is that not something people can do?
So the quarantine orders, I'm assuming it's issued by the county or the jurisdiction where this person was residing, continues until the time frame is met by the order. And so in this case, it's 14 days. And the reason for that is we have to have enough time in order for the infection to work its way through, so people become symptomatic, run a fever, have a cough. Even if you're feeling better, though, you can still be shedding virus. And so that's the reason for the 14 days, is to make sure that the public is completely protected from the person that had the virus.
Another outlet asks if you have thoughts on the announcement that Franklin County plans to open some businesses effective this Friday. That would include gyms, golf courses, and movie theaters, among others.
So again, I'll go back to my earlier remarks, which are we anticipate the peak of infections to occur in the St. Louis region on or around the 25th. We know that we're still seeing increasing numbers of infections, hospitalizations, people in our intensive care units, people on our ventilators. And so we're at the very top of the number of infections that we're seeing in the community. And so it would be difficult to say that now is the time to start relaxing social isolation and all of those other things that we've talked about to decrease transmission within the community. Our fear is always if we relax too much too soon that we will have this rebound effect. The virus hasn't gone away. It's still in the community. And we still have a large number of people that are susceptible to the infection as well. And so we have to keep those things in mind as we're developing our plans for reopening the economy.
Thank you. That concludes the list of questions received from members of the media prior to and during the briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.